Lisa Noll. I'm actually a colleague of Velda Baker's. I'm one of the other Penrose St. Francis Bay community nurses. I've been in that role for 10 years, working first at Marion House, and now my office is out at Westside Cares at 28th in Colorado. But so I would confirm much of what Velda said, but what I thought I'd share with you today is just a story that could have happened to any of you as a member of the community, and particularly somebody who lives downtown. I'm a member of Grace and St. Stephen's Episcopal Church, which is on Tejon between downtown and Colorado College, so we not infrequently have people who come to see us who appear to be struggling with poverty and homelessness. Some come to join our worship, many simply come to have a cup of coffee and something to eat if there's something around, or to use the restrooms, or to talk with people if there are people. Is this okay? Am I a good distance? You can hear me? Okay. To talk to whoever might be hanging around on a Sunday morning. And on a recent cold Sunday morning, I sort of get called to talk to people sometimes, and I was called to see a woman who was wandering around kind of unsteadily, and her sock feet was disheveled. She'd come in with a large garbage bag full of belongings and a small rolling suitcase that she'd somehow managed to get downstairs and leave downstairs and then come up to the parish hall. She told me she is 52, she's been in Colorado Springs for about 3 months and had lived in numerous states before that, most recently Texas. She said all her family's dead, there's no one she can turn to. She's been sleeping outside. She said she had a blanket and a sleeping bag. Her hair had been cut off, not in a short haircut. She told me it used to be long and down to her back, and it was clearly lovely thick hair, but it was just sort of chopped off all over her head. And when I asked her about it, she was kind of picking at her head, and she told me she'd been in the hospital and been treated because she had pus coming out of her head. And she also said her feet had been frostbitten. She had a tender scab at the base of her neck. When I asked her a bit more, and I'm a nosy nurse, so I just help people. I'm a nosy nurse, and they tell me things, but she said she had colonitis and has evil spirits coming out of polyps. And when I asked about meds, she said she used to take Risperdal, but she doesn't take it anymore because that's for people who are crazy, but she is not crazy. She said she had no money, no income. She didn't want to go back to the hospital because she'd been told by them not to come back. She had stayed at the Springs Rescue Mission, but she said it's dirty, there aren't any bathrooms, and my stuff was stolen while I was there. I know I'm familiar with the mission because I've been down there to visit lots of times. I talk to people a lot who are staying there, and I really admire the work that's being done down there. I know that there are people who are being greatly helped and who aren't freezing to death on the streets. I also know that it's a big place. I know how strained their case management resources are. I hear and I just have to believe that people say when they say they're standing in line for 2 or 3 hours out in cold afternoons in order to start processing to come in the gate at 5 o'clock. I have a hard time imagining how that woman would navigate that system, be able to actually connect with some case management for there. Trying to be in like 5 minutes. Anyway, I had people at my church who were trying to support this, and they absolutely could not believe that there wasn't some place we could send this woman who would take care of her. And I said, the only place is the mission, and I know she doesn't want to go. What we ended up doing was about noon, she'd been inside for several hours, she was warmed up, she'd had something to eat, we had a bit of a relationship with her, and we kind of convinced her that she would be willing to go to the mission, and I sort of tried to talk her through, how to navigate that all. We put her in the lift with a very seemingly sympathetic driver, off she went, and about an hour later I got a message on my little text message that showed the map, and apparently she'd gone to the mission, and then must have asked him to drive her back out, and it sounds like she got up about by the Marion House. So I just give you, this is an example of one woman's story of, in the sense of the impact that this has on a community of people, good citizens who said, well, can't we put her in a motel? Isn't there a mental health place that would take her? She's clearly sick, we can't send her out. We're short of services. Thank you.